I won't say much about the content of the white paper, except to point out they're actually the equivalent of 4 white papers. Because we've got the health white paper, followed very rapidly by the public health white paper, but followed by a government response around mental health, and then all of the vexed issues about adult social care and funding for adult social care. And you have to take them all together, but they're coming out at different points in time, but you have to kind of keep an eye on all of that. When the first white paper appeared, local government felt really pleased. Public health is coming back to local government. It's not the same public health from 1974. It's not the same local government from 1974, but there's a sort of feeling that this is about right. But it sets some very real challenges for colleagues in the public health world. Some of them have worked on clinical pathways and putting evidence into the work of hospitals and the work of health systems more widely are wondering what their role will be in future, because they actually do face the illness part of the system, and that's where they have their strength. And others are thinking, what will it actually be like coming to work in local government? At the most senior level, will I actually be sat around the top table with the chief executive? And if I am, what does that actually mean? And what will my responsibilities be like? So there are sort of some quite tricky questions. And the Local Government Association, in its response, and you have to work out, I could say this, I think, you have to work out the rhetoric and the reality of the statements, took the purest line that local government selects its own people and it designs the function that they are there to achieve. But we're actually talking, I think, about a TUPE transfer of a significant number of staff into local government by the direction of the Secretary of State. My guess is that's what will happen. So we now have, having irritated and upset the public health people, I think we now have to show them they are loved and that they will have a receptive home in local government when that transition is achieved, however it's achieved. Some other issues. Local Government Association protested strongly about a ring fence, but the ring fence is coming. So the protest has been made, but the ring fence is coming. What we'll be watching is just how prescriptive or how open the direction is about how the money can then be spent once it's transferred. We're a bit worried, I think, about quite how will this thing called a health premium be worked out. And what happens in areas which have got areas of communities that are actually very healthy. And inside those communities, there are places where health is actually quite poor. And how will that work? Because there was a kind of feeling the spearheads only covered half of the volume of health inequality in the country, and it left other places out. So there's a kind of quite a tricky issue there for local government. And there's a kind of really tricky question about the health organisations already beginning to fray at the edges. Huge management effort to hold things together, which is really very commendable. And in another place, I've used the expression that sort of, I heard somebody say in Manchester that their local PCT was disappearing like the grin on the Cheshire Cat. Thought that was appropriate today. But it is. It's difficult to retain staff during change and make sure you've got the capacity to handle that change well. So I think local government has got a huge responsibility to help make that transition work as well as it possibly can. We don't know a lot of things in local government about what our colleagues in the public health teams do, so we've got to be well informed about that. We're a bit worried about the 150 functions or thereabouts that PCTs run that don't seem to fit either into public health in transition to local government or into GP consortia commissioning. And it's about 150 odd kind of line items. Thankfully, somebody in the Department of Health is locked in a room with these lists and will come out with proposals about which bits might go where, and then we can have the discussions about it. Why is this important? Well, it's important because the health of local people is important both nationally, but to local government in particular. John Ransford said, he's the chief executive of the local government association at the moment, and he has been a joint health officer in the past. He said, health and public health has always been the responsibility of local government, even for the period from 74 onwards. It's just sometimes we forgot. And now we are, I think, remembering. We know how difficult it is. Health's improving. The tail isn't shifting. And we know that to get to the tail, you probably have to look at the gradient, this proportionate universalism, which is quite tricky. But I just want us to pause for a moment there and just ask why. Because if as a council you can't answer the question why, then some of the aspirations that are laid out in the white paper and in the Marmot report and so on will not be achieved. Why should we direct resources to people whose health is at risk in our local communities? And there may be an argument, they are the architects of their own misfortune. If I take responsibility for my health, why didn't they take responsibility for their health? And part of the answer might be, as I think Trevor was saying earlier on, we've managed to create in some places, in our effort to help, a culture of dependency. So the new public health has got to take account of the social determinants, these wider forces that do make a difference, and the way that we live in our local communities, and then what we can do about that as individuals. And it's quite a hard task, because as elected members, and I'm speaking particularly to the elected members at the moment, you are being asked to be part of an effort to change the behaviours of the people who live in your area in the direction of better health. And you can't do it by knocking on doors, as Trevor said. You might do it by targeting very small neighbourhoods, and Westminster was very, very successful around coronary heart disease by doing just that. Saturation work in a local neighbourhood, but from the outside, the professionals coming in. Or you might want to think this is actually long-haul territory, and we've actually got to work on the hearts and minds of people in our local communities and support them to change. There's some really big and difficult questions in this. Councillors as community leaders have a key responsibility in this new world, but it's not an easy one because I think you're being told, you're being given the power, but you're being expected to transfer some of it or to work with people in their local neighbourhoods almost as soon as you get it. And I actually heard this word, which I never imagined I would hear ever again, of double devolution, which I heard in Westminster from the coalition, double devolution around this. The bottom fifth, if you kind of unpack that, are the people who have great interest to children's services, social services, the mental health services, GPs. Everybody is, but there's bottom fifth particularly. Older people are isolated, disabled in poverty, not feeling supported. Young people who are in the not in employment, education or training group, whose life expectancies, from what we understand from the research, are shockingly low. So it is actually really bad for your health to be part of that group. Homeless people, people with mental health problems, people misusing drugs and alcohol, discharged prisoners, and there's a lot of overlap between those categories. They are sometimes the same people moving backwards and forwards. Specific ethnic minority groups, migrants, travellers, gypsies. This isn't comfortable territory. The number of times I've sat in debates about what to do around providing the sites for gypsy and traveller living. At the very least, though, and there is a strong commitment to this from the Department of Health, we've got to look after the health and education of the travellers and gypsies. But that's not an easy thing to say in many communities. So there's an amount of courage needed about that by our elected members, and it's quite a subtle thing to get absolutely right if you can.